Good evening, everyone. Welcome to First Aid AMC MCQ. How are you guys all? So I'm Dr. Arshan Ahmed. I'm going to be the main mentors for AMC MCQ lesson that you're going to have. So for the purpose of keeping this class without any noise, I kept everything as muted for now, but feel free to ask any questions in the chat box. And also we will allow you to unmute yourself at the end of today's discussion. If you have any questions, you will be allowed to interact with us throughout the class. Okay? And that's how we would do the class as well. Now, all of you are here because you want to learn how to proceed for your AMC MCQ exam. And First Aid AMC has the highest amount of passing candidates for the last few years. And it's not only for AMC MCQ, but also for clinical exam, we do the same. So as you see that normally we don't do a lot of advertisement. We don't, like, a lot of people even don't know sometimes that we exist. But most of you come here because you know that first aid is there from your friends, from your colleagues, maybe someone who passed the exam recently, or maybe someone who has done the course. So every one of you who are here, you have been referred by someone who knows about this course. So I want you to understand that part, that a course is usually well known when it has that much of a standard to continue for such a long years. We have been here and doing this MCQ and clinical preparation for IMGs for the last 8 years. And throughout these years, AMC has evolved, and we have also evolved in the same way so that we can keep pace with them. AMC changes their way of exam. They keep on making it difficult, and we also keep on making it stronger and stronger. And that's why our students pass the exam without any problem. So the guideline that we are going to provide for AMC MCQ to you, it's going to be the best. And that is all only that is all will you need for your exam preparation. You will not need anything else. And that's how we are going to prepare you in this exam. So needless to say, you all know that, like, how each month our candidates pass MC MCQ. This is just November last year. And we always say that November, there is a huge amount of candidates who will appear the exam. And it's for, like, every year in October, November, like there is always like a huge amount of candidates who pass the exam. And other months of the year also, like, candidates pass, but definitely the amount of students who appear the exam is less because everyone wants to wait till end. That's how we are, right? But I just wanted to show you that this is how it looks like, and you can be one of them. So it's not the most difficult exam in the world. You have passed more difficult exam in your life. Some of you have passed a specialist exam. Some of you might even have more experience than me. So remember one thing, that in here, I'm not here to teach you how to practice medicine. I'm here to show you how to pass this exam in your first attempt. Okay, because that is what you really need for this exam. You may be a specialist in, maybe you are a cardiologist in your country, maybe you are a orthopedic specialist there, but that's not actually what AMC will look for. AMC looks for whether you have a generalized knowledge on each subjects that you can come across in a when you are a junior doctor in Australia, because most of you will start in here as a junior doctor, and some of you will come as a registrar, but most of your entry level will be a resident medical officer or an intern. So AMC MCQ will assess you based on that level of experience. So do not think that you need to be a specialist to pass this exam. I passed this exam when I was an intern. So that's what you would do as well. And many of you are like that. So I want you to know that the course has different level of guideline based on where you are. If you feel that I am a beginner, I don't know anything about AMC MCQ, the course will be in a way that you really don't need to know anything. Definitely you passed your MBBS, so I will guess that you have that level of knowledge. Based on that, you will be able to blend in with the course, and you'll be fine to go for the exam. And if you're a specialist, then you have forgotten almost everything except your specialist degree. So you don't remember obstetrics if you are a medicine specialist. You don't remember anything about ortho if you are a cardiologist. So for you, the course has that same level of experience, same level of guideline that you will need to just to remember everything so that you can pass this exam. So the new course we're going to start is from 14th of June, which is just a couple of weeks away. And tonight is going to be your AMC MCQ introduction. So we will not discuss a lot of topics today. We will give you a very good idea that how you should start your preparation, because already there is a huge amount of students who have enrolled into the course. And I'm sure like more and more will enroll, because it's not the number of students that we are looking for. We look for the quality. So we want to make sure that every one of you who joins the course has that level of guideline from us so that you don't feel left alone. The new course that we're going to start in few weeks' time, it's going to be a very, very revolutionary change in AMC MCQ preparation, because we have updated the full course in a way so that it fulfills all the criteria, it fulfills all the guideline to pass MCQ. And already, like even the existing course, the courses that we have already done few years ago, those are like fully updated. But we want it to be more and more better. We have a new software, which is your student portal from your batch. Now we had a bit of a difficulty with the existing software, because sometimes we learned from our students that they have a bit of a difficulty with the existing portal. And we wanted to make sure that you don't have that problem anymore. So we created a new student portal, new website, so that that experience that you have with our materials is really, really excellent. And we have made, in a way, the new student portal so that it becomes very easy for you to navigate through that materials that you really need to learn. We are not going to give you everything and then ask you to read everything, not in that way. We will make sure that whatever we provide, those are important for your exam, and those are what will come in your exam. So we will come into the course details at the end of today's discussion. So just to give you a quick idea that from 14th of June, that last 2 weeks of June will be the free 2 week sessions. So every one of you can join our free session and get an idea how you should start preparing for AMC MCQ. And those two free weeks classes, so those two weeks free classes is really, really important. We discuss most of the important topics like cardiology. Today we are going to discuss a little bit about psychiatry. We will show you how we take our question solve classes so that you get a proper idea how this course is going to be. And then you can also see that, yes, this is the right course for me. I understand what they're talking about. I can get along with them. So yes, let's start with this course. And always try to choose a course based on at least few classes. Do not just blindly go in, because you might have heard from your friends or someone else that will do that course. They have got a lot of students, do that course. I always see a lot of people passing from this course. That doesn't matter, because what you really want, it might not be in that course. Can be even our course. We don't know. So you need to know that if you like how we are taking the classes, if this is going to help you. If it is not helpful for you, there is no point of doing a course and wasting the money. So please make sure before you enroll any course, because there are, like, I think at least 20 to 30 courses at the moment. Everyone has a course even after finishing their exam. I've just seen that someone just passed the exam, I think 2 days ago. They have a course now. So now the thing is that, is this is this is actually relevant for you? Because the person who is just passing the exam and having a course, or person who passed like maybe 6 years, 7 years ago, and not have never worked in Australia, is this person is your should be your mentor, because you need actually a mentor who is working in Australia, who has a proper knowledge about the guideline. Someone who doesn't know anything about Australian health system, someone who didn't work in Australia for like for any time, is a good person to be a mentor for you? That's what you should ask. Because a lot of things are written in the guideline. Like when we will take the classes, we will show you guidelines from everywhere. But the question is what we are practicing in Australia. Something like everything will be written in a guideline. But is this is something we are practicing in Australia? Because the people who are making the exam questions, they are also practicing in Australia. Their questions will not only focus on a specific guideline, but also day-to-day life practices. So the first thing I want you to make sure before you take any course is that ask them, can you provide us 2 weeks free sessions so that we know that you are actually the right mentor for me? That's what I will provide you, making sure that yes, you know what we are taking. You know that it is appropriate, it is following the guideline. The second thing is that you need to make sure that that mentor is currently working in Australia. Because if not, then actually he or she will not be able to fulfill your satisfaction, because they will struggle when they start solving questions for you. Because question solve, or commonly known as recalls, these are difficult. And without a proper knowledge in Australian health system, no one can actually answer this correctly. So these two are must to have. And then you should also look for a few things that, well, I'm currently working and just take my, I can't just take a course which does not provide recordings. Because without recordings, you might not be even able to finish your preparation. There are courses which will just provide you recordings for maybe 1 or 2 days, and then that recording will be deleted. I hear a lot of stories from a lot of my students who has enrolled in various courses, but they needed to come to us because those courses was just a waste of money and time. So the one of the most important thing is that, like, if you can't join a live session, then you need a recorded session. And that recording needs to stay for at least few months, because for someone who is working, someone who has a lot of things to do, they can't just watch the recordings within a day or so. And many times, because this is so vast amount of preparation, many times you, like, the first class, let's say cardiology is the first class, after 2 or 3 months, you will totally forget about it. So you might need to go back to that recording and again listen to it. So that kind of things should be there in a course. A comprehensive course should provide you that kind of facilities so that you can go back and listen to that recorded class whenever you want. So that's also will be there in this particular course. Okay. Some courses will not even give you any notes. But without notes, how are you supposed to prepare for this exam? Because you really need some notes, you need guideline, because otherwise you will be just reading and reading everything. So there are lots of benefit that we actually keep for our students in the course. And that is one of the reasons why our students also pass the exam in their first attempt without any difficulties. They don't need to search a lot. They don't need to go around and ask for a lot of things from other people. They don't need to. All they do is listen to our classes. They get their questions solved in the course, so they don't need to waste a lot of time on that. And they can also go and do a proper mock exam on the portal, exactly similar like your AMC MCQ exam. So the course is going to provide you with everything that you need to fully prepare for this AMC MCQ exam. I can assure you that there will be nothing else that you will need apart from what we provide. So lots of jib jabs. Let's go ahead. Today we are going to start first with AMC MCQ introduction. After the AMC MCQ introduction, I'm going to discuss a little bit about psychiatry, and we'll give you a bit of a touch about AMC MCQ theory session. So when we take a course, our classes are divided into theory sessions and question solve session. Each week, you are going to get 2 theory session and also 1 to 2 question solve session. So this is a blend of theory plus question solve so that you know how you can implement your theory knowledge on solving questions. Remember one thing, that just solving questions is not going to pass this exam. There is a lot of recommendation you will see from various Telegram, WhatsApp groups that will do the last 6 months recalls and you're going to pass this exam. Trust me that that is the worst thing you can ever do for your MC MCQ preparation. You need a proper theory knowledge, and only a person who has a good theory knowledge can pass this exam. He or she can do thousands of recall, but still they will fail this exam. And AMC, as I said, that AMC has evolved throughout these months and years so that they also know that you guys know these questions and many of you just memorize the questions. They change their questions. They will introduce a new sentence with that existing question solved, and then the question will be fully different question. But the person who is memorizing recall, they don't even know that the AMC has added a new sentence in that question, and the answer is completely different. So memorizing recall is not going to pass this exam. And also you need to understand that you are preparing to be a doctor in Australia. Without having a proper knowledge, how you can think that you can survive as a doctor in here? You need a very, very good knowledge, because you will be actually, now you might be passing your exam. And after passing exam, you will be dealing with a real patient in real life. And that is not easy with just memorizing a recall. Okay? So this is your time, and give that time to you so that you can build your career in a way so that it's not a lie. It's not something like you just memorize some questions and you pass the exam and you think you are lucky. You are not lucky. At some point, you will get that, you will be in that problem. And that problem is might cost a person's life. Okay? So that's what I'm going to give you, that full theory knowledge, which will be not only for passing this MCQ exam, but also you're going to actually know at some point in your life that this class, the 5 months class that I have taken, has changed a lot of your lives into medicine and other practices. Okay, so let's say go ahead and I will answer your questions about the courses at the end. So AMC MCQ exam, it's a MCQ format exam. And this is the part one of your being a doctor in Australia. It has 150 questions and it gives you 3.5 hours to finish these 150 questions. It's a computer adaptive software-based exam, or commonly known as CAT exam. So how this exam actually happens? So AMC has a proper user guideline about how the exam is going to be. I'll show you that today. But also let me explain a little bit that how this exam actually works. So the first of all, let's say someone prepared for the exam. After preparing your exam, ideally, like let's say 3 to 5 months ago, you should book your exam. And how to book your exam? There is a website called amc.org.au. This is the website which will give you a lot of idea, a lot of things about AMC. So this amc.org.au, if you go there, you'll be able to find out where, like, which months you are getting the exams, like what are the exam dates for each month. And also they will give you a very good guideline about how to register for the exam. Now there are a lot of things that people also needs to do before they can register for AMC MCQ, which I will not discuss in detail today, just to give you slight idea so that if you are a beginner, you know what you're looking for. So any person who has passed MBBS, they can go for AMC MCQ exam. You don't need to finish your intern or house job to appear AMC MCQ. So once you have your MBBS certificate, you can appear for MCQ exam. And to register for AMC MCQ exam, you need to have an Epic account. So in our course, we will show you the step-by-step approach, how to create an Epic account, what to do initially so that you can register for your exam. So once you have your Epic account, your MBBS certificate needs to be verified by ECFMG. Nowadays, you can do it online. So your MBBS certificate will be verified by this USA organization known as ECFMG, which can be done by online nowadays. Previously, it has to be done like person, but nowadays it's not. By person means that they used to like you needed to send your MBBS certificate to them, then they needed to send that back to your university, a lot of hassle. Nowadays, that's no longer needed. They do it online. Someone's microphone is on. Let me unmute. Let me mute you. So once you get your MBBS certificate verified, you will get a AMC candidate number. That candidate number is needed for you to register for AMC MCQ exam. And where you can register for the exam, that is where. If you go to amc.org.au, there will be an area where you can register for AMC MCQ exam. Before you register, you need to know like when the exam is conducted. So every month there is a set amount of dates where you can have your exam. So once you want to register, after having the candidate number, you can choose a date and time and you can go for the exam. Now, not every country has AMC MCQ exam center. So you need to know that whether your country has AMC exam center. Like I know that India, Pakistan, China, Thailand, Singapore, and definitely Australia, they have AMC MCQ exam center. I don't know anything else about any other countries. So if you are any other countries, please make sure to know whether your country has got AMC MCQ exam center. Because if your country doesn't have the center, you need to prepare a short stay visa or a visitor visa in that particular country so that you can go there and appear your exam. Okay, many like usually the Asian countries, most of the people will go to India, Pakistan. They might go to Thailand. They can also have a good time there and then have the exam. Many goes to Singapore. So you can choose your. No exam center is particularly hard or easy. There is a lot of myth about this that, well, India is really hard because I don't know why, because they don't like Indians or what, because that's really bullshit. Okay? So India doesn't have hard exam. Pakistan doesn't have hard exam. No countries have hard exam. So please don't think that just because you are appearing in India, Pakistan, or any other Asian countries doesn't necessarily mean that that country's exam is going to be hard. Every country, there will be hard exams. Okay? So please do not choose by this kind of myths. You can choose any country which will be near and easier for you. If you have a lot of money to spend, go to Singapore, go to Thailand, and enjoy after exam. Okay? So that's the one of the thing that you need to make sure that you talk to a migration agent so that you can at least go to that country to appear for that exam. Ideally, you should make sure that you should go to that country at least 3 to 5 days before your exam. If you think that I will just go the day before the exam, appear the exam, and next day I will be back to my country, that is a very big mistake because you can end up being sick when you travel a long distance or when you go to a new country. So have that 3 to 5 days time so that you can get adjusted in that country and then have the exam. For AMC MCQ exam, when you go to the exam center, it will look like a center where like a maybe 20 to 30 different computers will be there. So each of the computers like will be set up like this. Before you go into that exam center or exam room, there will be someone there who will ask for your ID. You need one primary ID and one secondary ID. One primary ID can be your passport or sometimes national ID, but passport is the best. So all of you will have a passport. So take your passport as a primary ID. And the second one should be your driver's license or your bank card where you have a authorized signature. Remember, not every bank card has a signature of yours, especially the debit cards. So you should also make sure that if you don't have a driver's license, then you should have a bank card where you have your signature there. Without that, that will not be accepted. Once you have done that, they will take you into the room, and after that, they will sit you in one of these computer. Okay. Now, each of these persons who is going for the exam will have different questions. You can't think that, well, he or she is very near to me, so I'm just going to see what this person is choosing for each question. That's really not going to happen because every questions in each of these candidates will be different from you. So that's where the CAT exam is. CAT exam is AMC has these thousands and thousands of questions in their question bank, and their software is designed to take some specific question from that bank and they will just choose that 150 questions only for you. The next person to you might have a completely different 150 questions. So how this software will choose questions for you. So how it works, let me explain, because you really need to know this, otherwise you will not understand. So let's say your first question will be a very simple question. And before that, let me say that 150 question has 500 marks. So how this 500 marks works, because 150 questions will give you 500 marks. So it's for sure that not every question will have just mark one. So you don't get one mark. You get multiple different kind of marks in each question. So some questions might be mark one, some questions might be 2, 4, 5, 6, even 10. Unfortunately, you will not know which question carries a higher mark in the exam. That will not be given to you. So each question will be important for you in the exam. Now, the first question that you get is a simple question. Maybe that mark is 1. So the software is designed in a way that the second, and let's say you got it right. So the second question the software will choose is just slightly difficult than this first question. So mark 2. You also got it right. Third question will be a little bit more difficult. Maybe that carries 5 marks. You also got it right. The next question will be really difficult. And let's say you didn't get it right. And then again, the software will start back from question, like simple question, and then gradually make it difficult. So that's how it works. So the AMC MCQ exam will be like this. So some candidate can say that I've got a lot of hard questions and I think I will fail this exam. But actually, it means that they might have actually did really good. That's why they ended up getting the hard question. And eventually we see that those are the candidates who pass the exam. And the other candidate who come and say that, Doc, my questions was all recalls and I even finished 1 hour before the exam. I'm sure I'm going to pass this. And that is the candidate who failed the exam. That's really common. Okay? So don't think that if your exam questions is hard, it might be good. That means you might be doing all right. So don't feel nervous or stressed out in the exam if that happens. Okay? Now, AMC does not say everything to us. AMC does not say that how their marking is. They don't even say that, like, what is the highest mark of a questions. So we don't know. No one knows. Okay? Now, out of 150 questions, AMC guideline says that if I show you the user guideline for AMC MCQ, so this is the user guideline, and this is really a good discussion about how the AMC MCQ exam is going to be. So you can see here that 150 type A questions. Type A questions means that there will be 5 questions and 5 options. Out of 5 options, only one correct response. So they will always give you 5 options, and out of 5 options, you need to choose one. And only one correct options for each question. Out of 150 questions, there is 120 questions which are scored, and 30 questions are pilot questions. Now, the problem is no one knows which 30 questions are pilot. We normally think that pilot questions are questions which are very big and even sometimes is so difficult and so complex, you can't even understand what they're talking about. Those are usually the pilot questions just to kill your time in exam. But we know that the last 30 questions are never pilot questions. So your last 30 questions are the most important questions, and those carry high mark in the exam. So 130 to 150, 120 to 150, these 30 questions are really important. They carry high marks and they are never pilot. Now, as you can see, AMC doesn't want to make it easy for you. So that's why they kept the last 30 questions as very high mark and also never pilot. So that if someone wastes a lot of time initially, they will end up being very hurried, or they will quickly try to finish these 30 questions, and they might even fail the exam just because they did not get these questions right in the exam. So time management is going to be really helpful, and it's really important, because if you can't finish your exam result will come as fail. Okay, even if you might have passed with 120 questions, still, if you couldn't finish 150 question, you will fail the exam. Doesn't really matter, because software will not even mark you. So time management is an essence. Time management is must. And in our course, we put we have already now 50 mock exams. And those mock exams are time-based mock exams. And that mock exam will make sure that you know how to manage your time before your exam. Okay, so don't worry. We talked about ID requirement. So when you go in, they will also give you a pen and a whiteboard. So there is a write board. That write board, you can you can write like you can write anything that you want on that board. So they give you a pen and a write board. Okay, and you can write anything you want on that board. That's all that you will be able to carry. Once you start your exam, or once you are in front of the computer, this is what you will see. So AMC examination, your name and candidate number. After that, they will say that do not touch the keyboard until you are instructed. So someone will say, yes, you can start your exam. After that, like, see this one, this is about, they give you this screen where you just need to know what are the code of conduct for AMC exam. So this screen will have a 5-minute limit. After that, like during this time, you must click on this I agree button. Okay, if you do not complete this within 5 minutes, your examination will be terminated. So you have to say, yes, I agree with the code of conduct. Okay, and if you say, I do not agree, your exam will be terminated on that time. So let's say you have agreed that, yes, I'm okay. What will happen then? The next is the second screen will give you a practice question. So they will give you some practice question so that you know that how this exam is going to be, which is usually 9 to 10 minutes. So this tutorial or practice question doesn't carry any mark and does not affect the software giving you like easy question or difficult question. So don't bother about them. Just quickly, like if you want, you can try answering them. That's up to you. But if you don't want and you want to get over with the exam, then just quickly click one of them and go ahead. Okay, so once you will do few of them, then there will be, so second and third question screen is done. On the fourth screen, that is where you'll be given this prompt that your exam contains 150 questions. You will have 3.5 hours to answer all questions. No additional time is added if you are going for a water break, or if you are going for a any washroom. So there will be no added time for it. You have to attempt to answer all questions. And you must make a selection before you can move on to the next question. So I'm going to discuss that with you just in a moment. So once you click on this next button, they will say, are you ready to begin your exam? You click on yes. Once you click on yes, they will say that this is what will happen, that there are 5 questions and out of 5 you have to choose one. Once you click next, your exam will be started. And on the exam, you'll be given a time like this. See this 199 That means they give you 200 minutes, which is 3.5 hours. And the clock will start to go backwards until it becomes 0. And you will have 150 questions. All right, so that's how it will be. Now, every questions that you appear, you will see that there is a next option, next button. Let me just show you. So let's say this is a question, or this is the screen. There will be a question here. There will be 5 options, 1, 2, 3, 4, 5. And then there is an option at the right lower end as a next. Remember one thing, that you can only go to the next question if you click a option there. If you don't click an option, you will not be allowed to go to the next question. Unfortunately, let's say you clicked one question and then you pressed next question. The next question screen has come up here. Suddenly you thought, oh no, I did wrong. That should be the option 2. I want to go back. Can you do that? No. So AMC will not allow you to go back and change your options. So once you click on an option as your answer, and if you click next and you go to the next page, that is done. The software has taken that answer as your answer. But let's say you didn't click the next option. Then you choose this one, and then you think, no, this is not my answer. I want to choose this. You can do that. So you can choose you can change your answer if you don't click the next button. Previously, you could mark, or there is an option of flagging a question. That means you could flag a question, like question number 1, you are not sure. You have just given an answer to go to the next button, and you just flagged it because you want to come back and then change the answer if needed. But nowadays, you can't flag anything. You can't come back. So it is a bit difficult nowadays just because they have changed it, I think, in the last 2 years. But still, it doesn't actually matter a lot. It's also better in a way that you don't waste a lot of time. Because many times what happens that when you think a lot, then the first answer is usually the right answer. And you think a lot and you usually you choose a wrong option at the end. So it is actually better. So once you finish your 150 questions, you will see that there is a finish exam or end of exam button there. Okay. So when you reach the last question, you can finish your exam by clicking on the end exam button at the bottom left of the screen. So after 150 question is there will be on the left side of the screen, there will be end exam button. Now, listen to this carefully, because sometimes I have seen this kind of like tragic thing to happen, which was horrible for a candidate, that they thought that 150 questions they have done and their exam is finished. They did not click on that end exam button. And because they haven't actually submit their exam, the software did not take their exam at all. And that candidate failed that exam. It is really, really horrible for any of you if that happens. So please make sure that you have to click on end exam button, and they usually also give you a prompt in here that, are you sure that you want to end your exam? Then you click yes, then your exam will be submitted. And then you're supposed to just raise your hand and the proctor will come and attend you, and that's it. Your exam is done. One of the other important thing to remember is that, let's say that you are running out of time. Like you just have 5 minutes and you're still in your 120 question. You have 30 questions left. It is very unlikely within 5 minutes you will be able to finish 30 questions. The chance is that you have mucked up your exam. But at least you will be able to know whether you passed or failed this exam if you can at least choose all 30 answer and click on end button. So make sure if you think that you don't have that time to finish your exam, then very quickly choose any option and at least click on end exam, because then software will at least give you a mark. Without that, you will not even get a mark. Your exam is not published at all. Okay. So this is really important to know. Without this, you are actually, and a lot of times, like sometimes, like when I was young mentor, I used to skip these things because I thought everyone should know it. But there was an incident like this, and then it just clicked my mind that, well, it's not that everyone will read these things. There are some of you who don't even want to waste your time and read the AMC MCQ specifications, which is clearly given. That's why I discuss each and everything, tiny little things, so that my students doesn't get this kind of problem. So now you know. Okay. You have to click the end button. Without clicking on the end button, your exam will not be submitted. Okay. Doesn't matter, even if you finish your 150 question, the software will not do it for you. You have to click end button. All right, so now we know how the exam works. So exam has 500 marks, and out of 500, if someone gets 250, they pass the exam. So it's not very difficult, right? Because it should not be very difficult to get half marks. So 250 out of 500 should not be that hard. That's why I say that if you really know the guideline, if you know what to read, how to come to the right answer, it is not a difficult exam to pass. But the preparation is long, preparation is vast. And if someone doesn't know the guideline, if someone doesn't know what is important for exam, they can waste a lot of time and still fail the exam. So the idea is having a proper mentor who can show you the important things, who can make things easier and smarter for you. Okay? Doing recalls with your study partner is not solely going to pass this exam. All right, so you can see that I just kept these ones for you to see that there are thousands of candidates who passed from first aid AMC. And if you see their feedback, then you will not have any doubt in this course. Okay, so let's move ahead. For AMC MCQ exam, there are only subjects. You don't need to have any basic knowledge. Now, definitely you should, but basic ones like pathology, biochemistry, those are really difficult. So those will not be assessed in your exam. The only thing that is assessed is medicine, surgery, gynae ops, pediatrics, psychology or psychiatry, and biostat or population health. 30% question can come from medicine, 20% surgery, and rest of them are like equally divided. But AMC, the software sometimes go nuts a little bit because it doesn't actually maintain this thing. There are candidates who say that I've got like all my questions are psychiatric questions. All my questions are full of pictures and everything. I got 10 ECG question in my exam. So sometimes AMC software really can go nuts and it can take revenge on you. That yes, I got you. Let me just give you all the hard questions I can. It can happen. So what I want you to do at that time, the thing that it is a love from AMC software to you. Because if you get 10 ECG questions and you can make it right, you will pass this exam. Because all ECG questions carry a high mark anyway. Okay, so don't take it personally in that case. So this is how it will look like when AMC give you the score after you finish your exam and you get your result. So I'm sure all of you want to be in here, not in that zone. So if any of you get 250 and above, you pass your exam. There are sad stories where I have seen that they just get 249. And this happens. There is nothing we can do about it. Sometimes I still don't know how AMC actually marks candidates because they don't usually say these things. So sometimes this thing can happen. And unfortunately, because this is a software-based marking, even if you appeal for this, most of the time it's not going to be changed. So if this happens with you, please don't be heartbroken. There are things that happens in your life for a reason. Maybe you needed a little bit push. Maybe you needed a little bit more experience before you go for the exam. And that is good for you. Think positively, prepare again, and you'll pass this exam without any problem. But so far, our students, I have seen like hundreds and hundreds of students who passed the exam. Most of them had a positive experience, and they always say that the learning that I have got from this course, that was enough for me to pass this exam. And that is what we love to hear, that yes, that means we are doing the right thing for you. Now, going to the research that you will need for your AMC MCQ preparation, these are the list of books and websites that you need to prepare for your exam. Our main three books are this: John Murtagh, 8th edition. Second is we're going to focus a lot from therapeutic guidelines and Kaplan Step to CK. These are our main three guidelines that we will follow in the course. But subject by subject, there are a few other things we always go through. Like for medicine, RACGP guideline is must to do. All RACGP guidelines are super important. Like what? Let's say you want to learn what is the Australian guideline about hypothyroidism. All you need to write in the Google hypothyroidism RACGP guideline, and you will see that there are 4 to 5 guidelines pop up. So those guidelines are Australian guidelines for medicine. And because medicine carry a high mark, you will need to focus a lot. You need to have a proper knowledge from John Murtagh. Some of the guidelines you will take from therapeutic guidelines, and also RACGP will be one of your main research as well. Because John Murtagh, although it is very good for general practice, but it's not really, really good for AMC MCQ because the questions that they ask, sometimes John Murtagh make it confusing. But to understand something, it is really a good book. And to understand the Australian guidelines, it's also a good research. But sometimes you will need these other guidelines. Like for management, therapeutic guideline will be really good. Like we can find out what are the updated antibiotics and all other management. So for management, we will focus on this. Also, we'll take help from John Murtagh and RACGP. Okay. For surgery, there is no Australian guideline, unfortunately. That's why it becomes a bit difficult. We mainly take help from Kaplan Step 2. Pediatrics, John Murtagh is very good. And also one of the important thing is RCH website. So that is must to do. And a bit help from Kaplan. Gynae Ops, John Murtagh is really good. So we'll take most of the help from there. And sometimes we take help from SA Health, which is an Australian guideline for obstetrics. Psychiatry, John Murtagh is not that much of a help, unfortunately. Kaplan Step to CK will be your best buddy for psychiatry. And psychiatry is going to eat you because most of you don't know about psychiatry. But I want you to know that like I have a very, very good knowledge on psychiatry. And how I am going to teach you psychiatry will make it super easy for you. Okay, so you don't need to be worried at all about psychiatry. After finishing 4 classes of psychiatry with me, you will love psychiatry. So that's on me. Okay. Sometimes we also take help from UWorld USMLE. So we'll discuss that. Ethics. So we take ethics class in the course, but you can take help from these 100 cases of Conrad Fisher. And statistics from Kaplan Step to CK as well. Not really important. There are only 1 to 2 questions that come from a stat, and these are usually paid questions. So that's the common list of books and website. Throughout the course, when we do each subject, each topic, you will learn about them more and more, and you will get oriented. Now it looks like, oh my God, this much book and resource, how am I going to finish this? So it's very common. I had the same feeling, but gradually it gets better. So one at a time, you will see that it makes sense. It makes easier by itself. Okay. So let's see if you guys have any questions so far before we move on to psychiatry. So the classes, so we will discuss about the course just at the end of today's discussion. So if you guys have any questions about the course itself, just keep it for the last. Yeah, that's right, Dr. Rubia. The OPS is not good in John Murtagh 8th edition, but John Murtagh 6th edition has got all the obstetrics chapter, and we discuss it from there. Yes, this class is recorded. Last date to enroll this course, you should enroll as soon as possible. We are going to give approval to our course. Like you can actually start getting access to the student portal from 1st of June. So I would suggest that, well, if you are sure that you want to be in the course, then make the payment through our website and just wait till 1st of June. Okay. But normally we allow anyone to join anytime, but it's ideal to start with us because think one thing that someone who will join the course in the middle of the course will not even know at that time that how to start the preparation, because now every one of you who are here, you actually have got a clear cut idea that how the exam is going to be and like what to prepare for. At least that idea sometimes can take months and months because everyone says different things. So middle of the course or even like after a month of the course, if someone joins, it becomes a bit difficult. They can catch up because everything is recorded. But I always say that if you want to join from now because you can actually go the step by step that we are taking you in, which is the best approach. Yes, Dr. Fajilat, you can take the free classes till end of June and you can also enroll at that time. So that's fine as well. You don't need a subscription for therapeutic guideline. We will show the important things for you, so you don't need to worry about that. And all these books and everything will be provided to you as a soft copy. For a satisfied preparation for AMC MCQ, you need at least 6 months. Okay, so 6 months is must because no one can at least like no one can prepare for AMC MCQ exam within 2 to 3 months. It's difficult, it's quite impossible. So at least have 6 months as your preparation. If you do our 5 months course and you can finish everything as we do, you'll be well prepared by that time. And take 1 to 2 months for a revision and then go for your exam. Not more than that. There is no difference. So we don't have a offline course per se, but what many of our, like half of our students do is that they don't come to the online session, like live session. They just do the recorded class when they can. So how this works is that we take our class like this and we put the recording the next day. And we keep the recording for like the common subscription plan provide you recording for 10 months. So you get that recording for total 10 months and people just go through that recordings when they can and make their own way. That is offline way of doing the course. I don't recommend that because it takes a lot of time. But someone who doesn't have that time, they really and they want to prepare for this exam, I can't ask them that, yes, you have to come to the online exam and forget about your work, forget about your life, just come and do the online class. That's not supposed to be for someone who has a lot of other things to do. So for them who can't, whose time, like Australian time and your time might not actually work. So if that is the case, it's not necessary to come in the live class. You will get everything in the recorded class. But the only thing is not possible that a lot of people, like I always get more than 100 students in my live class without even any problem. So those 100 students, usually they can ask questions if they have a trouble to understand. But for someone who is just doing recorded class, they don't have that opportunity. Still, we allow them to ask questions through the messenger if they have really any kind of trouble. But again, it's very difficult for us to answer questions that they have in messengers. So, or in any other social media. So it's always better to come to the live sessions, but if you can't, then yes, go for the recorded sessions. It works for a lot of people. No, AMC doesn't conduct exam in December or January. So November is the last, and then it starts again in February. Okay, let me start with the psychiatry because otherwise we might not be even be able to touch the psychiatry today. So let's start psychiatry, and then we will again come back to the course descriptions. Okay, so these are your books that you need for psychiatry. Yes, about the recall. So as I said that the course is divided into theory and question solve. So question solve classes are done by our mentors. Question solve classes will be there, one or two questions solved each week. So you really don't need to waste your time to do these recalls or any other questions. So the course is designed to solve questions for you and show you how to come to the right answer. Okay? So the course is going to show you everything. And we have like past 5 years question solves in our portal already. So you will be able to go through those questions and remember one thing that the question solve is not for you to memorize. It's for you to understand that what is important for exam, what kind of topics are favorite for exam, and how to prepare for that topic. We don't recommend you to memorize recalls or question solve. It is not recommended and it's just not the best idea. So from these question solve classes, you are going to learn how to come to the right options or right answers in the exam. And what are the common questions that you should definitely prepare for your exam? Okay. So moving on to psychiatry. Now, a lot of your questions that you have, those questions, we already provide a very detailed course descriptions in our website. So I want you to go into our course website and details. So this is our course website, and you can easily read our course detail, and most of your answers, questions for the course will be there. So I'm putting it as a link in there. So firstaidamc.com.au, if you even write it, it will pop up. And you can go down here, and that's your MCQ course. Click on check info, and you will see that each and every detail about question solve, about like how many days we take classes, everything is written, even how much access, everything is here. So give it a read, and most of your questions will be answered by this. Okay? But definitely, if you have any specific questions, I will answer them tonight after end of the psychiatry class. All right? So Psychiatry. So psychiatry is an interesting chapter. Although AMC says that it's just going to be 12.5% questions from here, sometimes a lot of candidates say that they get a lot of psychiatry questions. So you need to prepare psychiatry really, really better so that if something difficult comes in exam, you know what to do. And psychiatry questions are difficult. And though those are a bit time consuming, they are quite large questions. So you will end up losing a lot of time during your psychiatry questions. So if you don't have a good basic, you will end up wasting a lot of time. So the books that you need for psychiatry is John Murtagh 8th edition. Kaplan Step to CK is really good. There are a few websites we can take help, but it's not really necessary. We provide this U-World USMLE book. U-World USMLE, the psychiatry portion of it is really good for building your basic. It gives you question and also it describes the answer in a way that it gives you the idea that how they come to that option or answer. So if you want to build your basic on psychiatry, doing this U-World USMLE psychiatry questions is going to be really helpful. And we will provide a soft copy in our website. The first aid lecture note has almost everything that you need for psychiatry anyway. So we will discuss that. And after we do the 4 class on psychiatry, we're going to take a psychiatry question solve. So we take questions from all the months and then we put it in a PowerPoint file and we discuss those questions together. That gives you an idea that if this theory knowledge that you have from psychiatry, is this going to help you to come to the right answer in the exam? Okay, so our theory classes are designed in this way. So we take, it's a 3 or 4 class on a particular theory. And then after that, we do the theory-based question solve discussion. And that usually gives you an idea that how the exam questions will look like. So just like psychiatry, or even let's say we took 4 classes on gynae, after that, we do a gynae question solve. And that gives you an idea that how the gynae questions looks like in the exam. And also, there is theory-based question solve. And then there is monthly question solve, which is like each month that we are taking your classes, every week you will have this random question solve, which will give you a proper idea about the recent questions, how these questions can appear in your exams. It's going to give you an idea that what are the important topics for your exam. Okay. So this is how we divide the classes. So theory followed by theory-based question and in between random question solve. All right. Let's give you a test of our psychiatry class today. So tonight is not about how we take our class, because our class is more extensive than what it will look like today, because we already talked a lot, right? So tonight class is just to give you a test of our theory class. And when we start our 2 weeks free session, you will get a proper idea that how our theory and question solve classes look like. So although our first topic is depression, I don't want you guys to feel depressed, all right? But depression is an important topic for psychiatry, as you can understand. So major depressive disorder. So major depressive disorder, also known as MDD, is a very important and it's a very common finding in psychiatry. So patient will come to us saying that I've been feeling really bad over the last few weeks. They can also say that they have been experiencing loss of appetite, loss of weight, loss of concentrations, feeling hopeless, helpless, doesn't feel energetic anymore. And most importantly, they feel very low or depressed. So major depressive disorder, just because someone's saying that I feel very low, will not give you the diagnosis of MDD. MDD has a specific criteria. Okay? So to have the major depressive disorder diagnosis for your exam, the criteria is at least 5 of the following symptoms every day for at least 2 weeks. So the DSM-5 criteria fulfills that. So we follow the mnemonic called MCAPS. So MCAPS has 9 symptoms. 5 out of 9 symptoms, if it is there for 2 weeks, then we can call that, yes, this patient has got major depressive disorder. So that is MCAPS. So M for low mood, S for sleep problem, which is insomnia, I for loss of interest, G for feeling guilt or hopeless, helpless, E for lack of energy, so fatigued, tired, C for concentration, so loss of concentration, A for lack of appetite, P for psychomotor changes, and S for suicidal thought. Now, out of these 9, there has to be at least one of these two. So either patient will have low mood or lack of interest. So criteria 1 or 2 is essential to make the diagnosis. So yes, they will have to have 5 out of these 9 symptoms, but at least 1 or 2, any of these 2 should be there. So they have to have a low mood or lack of interest to make the diagnosis. Okay? So what is psychomotor change? So there is psychomotor retardation and there is psychomotor agitation. Both can be there in a depressed person. Psychomotor retardation means the patient say, I feel very slowed down. Everything is slow for me. I can't feel the energy to do anything. Psychomotor agitation is that they become very agitated and aggressive because they are depressed. All right? So we have got 9 symptoms of low mood, lack of interest, reduced weight, change in sleep, psychomotor problem, loss of energy, feeling guilty, impaired concentration, and suicidal thought. There are a lot of questions which come in exam from here. One of the question will be, they will give you a patient who looks like depressed, and they will ask you that, what is the most important symptom that you need to rule out in this patient? So what do you think? Out of these 9 symptoms, what is the most important thing you will assess? So most important, so that's the thing, most important in a psychiatric patient is if they have suicidal thought. So you need to rule out whether they have any suicidal ideation or suicidal thoughts. Okay? That is the most important thing. Now, if they say that what's most important to make the diagnosis? So reading the question is really important for AMC MCQ because they love to change the question just by changing some letters or words. So they change a word or add a new word and the answer is different. Like how I have done it. So if I give you a depressed patient and I say, what is the most important symptom that you would rule out in this patient? That's suicide. What is the most important symptom that you need to make the diagnosis? That's either a depressed mood or lack of interest. Okay? So that is why we say that you should read your question properly because the questions will be different. Now, the 2 major criteria for MDD, as we already know, depressed mood and marked loss of interest. Now, someone having every symptoms, all the criteria, but the symptoms is only for a week. Can we make the diagnosis of MDD? No. To make the diagnosis of MDD, the symptoms needs to be there for at least 2 weeks. So all of this matters when we make a diagnosis. Lots of other criteria is there for depression apart from MDD. So there are persistent depressive disorder. So persistent depressive disorder means if someone has low severe, like mild severe depression lasting for 2 years or more. So if someone has got like a depression ongoing for 2 years, but they are on mild severity, that's called PDD. Coming back to depression, major depressive disorder, all those M-Psych caps you have learned, those are typical symptoms. So what are the atypical symptoms of depression? Atypical symptoms are this. Instead of lack of weight, they can gain weight. They can have increased appetite and increased sleep. So these three are called atypical features of depression. What is the worst association? If a major depressive disorder patient has psychotic features like hallucinations, delusions, that has the worst prognosis. All right. So first you made the diagnosis, and then you need to manage a major depressive disorder patient. So how you're going to manage a MDD patient depends on whether it is mild, moderate, or severe depression. So first you need to know who is mild to moderate and who is severe. There is no specific guideline how we can like put a patient in a mild depression or severe depression. So for the purpose of exam, make it mild to moderate or severe. That's easy to differentiate. Mild to moderate is someone who is depressed, but it's not affecting their social, personal, or occupational life drastically. And also, they don't have any active suicidal thoughts. If someone is having major depressive disorder, plus they have suicidal thought, that becomes a severe depression straight away. Or if it affects their social, personal, familial, occupational life, then also it is severe. So once we know that whether it is mild to moderate or severe, we can manage this patient. So mild to moderate, the first line treatment is psychological counseling. And the best counseling is called cognitive behavioral therapy. Cognitive behavioral therapy is something which a psychologist will talk to the patient. They will learn what's bothering this patient, and they try to convert their negative thoughts about their life to something positive. That's CBT or cognitive behavioral therapy. That's usually the first line treatment for most of the psychological problem anyway. But for mild to moderate, we will start with CBT. If it is severe, psychological counseling is not the only thing that can help. When it is severe, you need to put the patient on an antidepressant. Plus, you can send the patient to a psychological treatment. Okay? Now, let's say it is that severe that even after antidepressant plus psychological counseling, still it's not getting better. You kept on like trying multiple antidepressant, did not work. The last option is electroconvulsive therapy. That is the last resort, and it is usually kept for like very, very severe major depressive patient who has life-threatening depression. That means if you don't treat them with electroconvulsion, they are going to die. So we will discuss some questions based on that later on, but that is the step-by-step treatment for the psychiatrist for this condition. Okay. Now, while we are on the topic, I want to give you an idea that how the questions can look like. Let's have a look. A 72-year-old man comes to the office due to worsening depression and insomnia since his wife died 7 months ago. The patient experienced lethargy, episode of tearfulness. He has little interest in socializing with others. He has attended 3 sessions of psychotherapy. However, patient continues to feel depressed, now experiencing severe insomnia. See that like this, the point that I am actually showing you, these are the important things to take from a question. So when you read a question, you don't need to read everything. You read the important things and you keep an eye on it. He has difficulty falling asleep, frequently waking up at the night. He feels very guilty about her death. The patient experienced a moment of severe depression last week. He had a thought of suicide because there is nothing left in this world. However, he asserts that he would never act on those thoughts. Physical examination shows a loss of weight. Which of the following is the most appropriate next step in the management of this patient? Now, how the exam questions come. Exam questions, the first thing is after you read a question, you need to focus on what they are actually asking because the answer will be different based on the question. So the question can be like this. Sometimes the question will be, what is the next most appropriate management? What is the next step of management? What is the next best management? What is your initial management? What is your next appropriate management? All of these are same. All of this means that as long as there is a next, it means what is your next step? You have done something, and after that, what will you do? Okay, it includes both investigation and management. So they can say what is the next most appropriate investigation. They can say what is the next step of investigation. So investigation and management, the same thing applies. What about sometimes they will say what is the best management? What is the most appropriate management? What is the definitive management? Now, this means that they are not asking about the next thing. They're asking you that what is the best management for this particular condition. All right? They don't care about what you want to do next. So this is where most of the candidate will either pass or fail the exam. Okay? So if you don't know what is next means and what is this best or most appropriate means, every answer you are going to put in your exam is going to be wrong. And this is where a lot of candidates who doesn't know about the exam questions, they will get it wrong. So now we have got a patient who has definitely suicidal thought. And our first thing is, does he fulfill the criteria of major depressive disorder? We need at least 5. So we can see that patient has got insomnia, 1, lethargy, which is lack of energy, 2, patient is tearful, which means sad or depressed, lack of interest, 4, feeling guilty, 5, lack of loss of weight, 6, suicide, 7. So already there is 7, right? So definitely this is a major depressive disorder. And on the top of that, patient has got suicide. So when there is suicidal thought, then yes, it is a severe depression. What we have done so far, we have only the patient has 3 sessions of psychotherapy. What is the next step? So increase the frequency of psychotherapy, prescribe amitriptyline, which is a tricyclic antidepressant, and continue psychotherapy. Prescribe mirtazapine and continue psychotherapy. Now, this is a newer antidepressant. prescribe zolpidem and continue psycho. Zolpidem is a benzodiazepine, like a newer benzodiazepine, but we don't prescribe benzodiazepine for depression. I know it can help with the sleep problem, but it's not recommended. We very rarely we will ever choose benzo in the exam question as an answer. Provide reassurance. That's not going to help, right? Because this patient needs something more. Recommend ECT. Well, if ECT might be needed, but it's still too early to decide. We haven't tried our next step. The next step is an antidepressant, and we have option B and C to choose from. Now, in your exam, many times you will come across to this kind of problem. That means both options are correct, but you know that you have only one best option to choose. Now, you can't argue with AMC that, well, I choose B because this is also antidepressant, but you are saying it is C. Why B is not correct? Because it is not the best option. So AMC most of the time will give you two options which will be almost equally right. But still, the main problem will be that whether you can come to the best option to choose. Okay? So the best option in here, remember that yes, TCA is good, amitriptyline can help the patient to sleep. But for a 72-year-old, amitriptyline can cause a lot of problem also because it can cause urinary retention. And most importantly, this is not the first line antidepressant anymore. The first line antidepressant is SSRI, which we will discuss. Then we have SNRI. Then we have newer antidepressant or atypical antidepressant such as metazapine. And then we have tricyclic antidepressant. So in this case, metazapine will be our choice because it is a very sedative medication, like sedative antidepressant, and it is also first in the line rather than TCA. Okay, so we choose metazapine based on the fact that it's much better. It has less side effect for a 72-year-old, and most importantly, we choose either SSRI. If not, then SNRI. Then we have the option of newer one like metazapine, and then the TCA. Okay. Now let's talk about what are the common SSRI that we have. So SSRI is the serotonin reuptake inhibitor or selective serotonin reuptake inhibitors. You remember from the pharmacy, right? So pharmacology, I'm sure you learned a lot about them, but you don't need to learn pharmacology for AMC MCQ, but you need to know common side effect for the medications that you commonly use in your day-to-day life. So although pharmacology is not assessed in that way, but AMC loves questions for drugs. So drug-related questions are super important. So you need to learn about side effects for this common medication. So we have SSRI like fluoxetine, citalopram, escitalopram, sertraline, paroxetine, fluvoxamine. So these are all SSRI. So what are the common side effects of SSRI? The common side effect is nausea, vomiting, tummy upset, and sexual dysfunction. Okay, so headache. So some can give you headache, nausea, vomiting, abdominal upset, and sexual dysfunction. These are the four most commonest side effects. And there are lots of other side effects. You can give it a read, but it's not important. Whereas metazapine, side effect is severe sedation. So it can make you sleepy a lot. So someone who is already very sleepy, do not give this medication to that person. He will sleep like hell. Otherwise, it can cause constipation, drowsiness, weight gain. So other is not that important. Just remember the severe sedation. Then we have SNRI. So selective noradrenaline reuptake inhibitor. So SNRI, they are also antidepressant, but the common to SNRI is venlafaxine and desvenlafaxine. Effexor is nothing but venlafaxine. So venlafaxine and desvenlafaxine, these are also commonly used in Australia. So they also give you nausea, headache, insomnia, loss of appetite. Now, this is one of the antidepressant. Out of any antidepressant that you can use, this is one of the antidepressant which doesn't cause weight gain. So if patients concerned, a lot of young patient who comes to us and they say that I know that I need an antidepressant, but I don't want to put on weight. Do you have anything for me? That is the time we will choose this venlafaxine. Okay. There are some serious side effects of this, like it can increase blood pressure. You can't give this medication in an epileptic patient. So that's the main thing to remember. And also it can cause hyponatremia sometimes. So for a patient who has uncontrolled hypertension or epilepsy, Effexor is not a medication to give. Now I'm going to discuss with you some important questions about the side effects that commonly come in exam, and you need to learn about them. So sit tight. First question, you have got a patient, and let's say a 35-year-old patient, male patient, you started the patient with an antidepressant. Let's say you started the patient with citalopram. Okay. Now, this patient is on citalopram for 4 weeks. Since you started this medication, patient has got severe nausea, vomiting, and abdominal pain. So patient actually tried, because sometimes initial, like if the patient comes within a week, you can say that, well, sometimes it can take time to get adjusted to the body. But 4 weeks a lot. So patient tried his best. Still, it's not getting better. So no point of asking the patient to be on this medication anymore. So what will you do for this poor patient? So are you going to change the SSRI to a SNRI? Or are you going to change this SSRI to another SSRI to see if that works better? Are you going to change this SSRI to something else, like maybe metazapine or maybe a tricyclic antidepressant? What do you want to do? Yes, the guidelines say that you change it to another SSRI, because that if a patient has got abdominal discomfort from one SSRI doesn't mean he will get it from another SSRI. So if it is just abdominal problem like nausea, vomiting, abdominal pain, then you can change from one SSRI to another SSRI. Now, how we change it, that's also important. So if we need to change, let's say we want to change from citalopram to fluoxetine. Can we just change it without anything? Like we can stop citalopram and next day we can start fluoxetine? No, because then patient blood will have a lot of serotonin, and that serotonin will give a condition called serotonin syndrome. So we can't do that. So idea is you gradually lower down the dose of citalopram. So you will gradually taper the citalopram over a couple of weeks, and then you stop it. So you stop the citalopram and then you give a washout period. That means sometimes even if you stop the medication today, the medication effect can be there in the blood for a few days. So usually 3 to 4 days, patient will not take any medication. And then you start the fluoxetine after that. That is the best way to do it. Doesn't matter because all SSRI has serotonin in it. So if you don't give that washout, then what will happen that patient blood will have citalopram, and then you are starting another SSRI which also have serotonin. So you will end up causing a serotonin syndrome. That's why we need a washout period. Okay. Now that's your first question. Let's come to the second one. You've got a patient with, let's say it's a 35-year male, Jason, started with sertraline. Sertraline is also a SSRI, 100 milligram. So sertraline comes as 50 milligram and 100 milligram. So maybe the patient initially started with 50 and then it has increased to 100 milligram. And patient is on this sertraline 100 milligram for 3 months. And now patient's wife want to divorce the patient because he has erectile dysfunction for this. So patient has got a erectile dysfunction after starting the sertraline. And now, although he's not that depressed, but the problem is that his wife doesn't want to stay with him anymore. Now that is a serious problem. So what do you want to do for him? So erectile dysfunction or sexual dysfunction is very common complication from SSRI. Now, there is a condition which you can't just change from one SSRI to another SSRI because almost every SSRI will give some kind of similar kind of sexual dysfunction. So if you change this person from sertraline to fluoxetine, fluoxetine will also cause the same problem because almost all of the SSRI gives a similar kind of sexual dysfunction. So changing it from one SSRI to another SSRI is not going to work for him. Changing it from SSRI to SNRI is not also going to help. So what options we have? We have one option that because if the patient's depression is well controlled with 100 milligram, we can reduce the dose and see if that makes it better. So you can reduce sertraline 100 to 50 milligram and see if that makes a difference. If it's still not causing any improvement, then you need to do something. So then you can try to change it to metazapine. So metazapine has a very low sexual dysfunction. You can change it to bupropion. So there are some very atypical antidepressants which we don't commonly use. That's what we can try. The third will be like, let's say we reduced the dose, did not work. We changed to metazapine, bupropion did not work. The last option is add Viagra or sildenafil. So this is the step by step that we can offer for this patient. Okay, is it clear for everyone? All right, so now we know how to manage these side effects from SSR. And these are the two commonest side effect based questions that will come in the exam. Okay, so now moving on, we were talking about serotonin syndrome. So serotonin syndrome is a rare side effect, but again, it's very urgent and it's an emergency kind of a condition. So when a patient is on multiple serotonergic medication, it doesn't matter that if it has to be a SSRI. Sometimes it can be something else which has serotonin in it. So if a patient comes to you with more than one serotonergic medication, like patient taking two SSRI, patient taking one SSRI plus a tricyclic antidepressant, patient taking a SSRI plus another SNRI. So when there is multiple serotonergic medication, not only that, some opioid like tramadol can increase serotonin, some illicit drugs, antiemetics, these can also increase the amount of serotonin, even alcohol. So when a patient has this multiple amount of serotonergic drugs, they can end up getting a complication called serotonin syndrome, which presents like this. So patient will come to you with altered mental status, so agitated, confused, sometimes even they can have seizure, altered muscle tone, so they can have tremor, shivering, hyperreflexia, autonomic instability, so hypertension, hypotension, they can have tachycardia, fever, diarrhea. So if you look at this patient, you can see every kind of symptoms serotonin syndrome can cause. So you can see patient looks diaphoretic, so excessive sweating, tachycardia, the pupil will be dilated, agitated, diarrhea because like autonomic instability, hypertensive, hypotensive, hyperreflexia, tremor, clonus. So all of these are features of serotonin syndrome. Now there is another condition called neuroleptic malignant syndrome, which is a complication from antipsychotic medication. So if a patient is on some antipsychotic medication like risperidone, olanzapine, then it can cause a complication called NMS. How to differentiate between these two? The first thing is that this patient is taking some serotonergic medication and this patient taking antipsychotic medication. The second thing is it gives more tremor, serotonin syndrome, whereas NMS causes muscular rigidity. Reflex will be increased here, decreased in NMS. Pupil will be dilated here and normal in here. So that's how we can differentiate between these two. Now, what we need to do if a patient has serotonin syndrome? That's a very commonly asked question. If a patient is on serotonin, like if a patient develops serotonin syndrome, you need to stop any serotonin medication immediately. So this doesn't need tapering. If a patient is on sertraline and amitriptyline, you stop both of them straight away. And then this patient also needs to be admitted in the emergency department, sometimes even in ICU if needed. So that's serotonin syndrome. So one of the other thing that once we start medication, so if you start someone with antidepressant, how long they need to continue it? That comes in exam also. If it is the first episode, then it needs to be continued for a minimum of 12 months. And if it is subsequent or patient getting recurrent depression, according to JM, it is 2 to 3 years. Some other Australian guidelines say 3 to 5 years. But we will still keep it for 2 to 3 years as per JM. Okay. So that's mostly all about depression. I don't think there is anything else I missed. One other thing, how long a antidepressant should be tried before you need to change it or before you consider that it's no longer effective? Anyone have an idea? Four to 6 weeks. So you need to continue the medication for 4 to 6 weeks to say that it is no longer effective. So someone who you started an antidepressant and came back after 2 weeks that, doc, I don't have any effect. I don't think it is working. I want to try something else. Are we just going to change it? No. You will say that, look, it takes at least 4 to 6 weeks to give its maximum benefit. So why not we wait up to that and see how you go? And then if it's needed, we can change it. So that's the idea. Okay. Dr. Ali, which one? The last slide, this one? Yeah. So we said that how long antidepressant should be continued. So if it is initial episode of depression, then 12 months. And if it is subsequent or recurrent depression, then 2 to 3 years according to JM. Some other guidelines say 3 to 5 years, but we keep 2 to 3 years. What if someone has serotonin syndrome? Then you will gradually start one of them. So serotonin syndrome will happen if they have multiple antidepressant. Okay, this has nothing to do with serotonin syndrome. Even if a patient develops serotonin syndrome, yes, then gradually you can reintroduce one serotonin medication and see how the patient goes. Ideally, you are not supposed to use multiple SSRI anyway in a patient, but somehow the serotonin syndrome ends up getting them. All right. So that's mostly all about depression. Now you can see that how we discuss a topic in our class. This is how the classes will look like. I don't think we need to go further today. Normally, I can do a little bit more, but today I took a little bit more time to give you an idea about MCQ exam so that you have that knowledge in your head that what I am preparing for. And then we can finish psychiatry in our course. That should not be any problem. Okay. So the psychiatry we will discuss in our course more and more. There is a lot of topics to discuss, but that's how it usually will look like. Okay. Now, let me just give you an idea about the course because I can see you guys have a lot of questions. And then after that, you can always ask some questions as well. Okay. And again, remember, we will have 2 weeks free sessions also. So if you have any questions, this is not the end. You can always ask more questions as we go. Yes, this is a recorded class. It will be available on YouTube. How can we access the free trial before deciding on the full session? The only way to access the free class is to do the free class. Okay, so the class schedule will be given on your Facebook group. So if you are not in our Facebook group, definitely join in our Facebook group. I'm putting the link in here in your chat box. So join the Facebook group. In here, you will see that we will always update everything. So we'll give you the schedules of those 2 week sessions, and it will be the same like today. So you can come to the June class and have those free classes with us. Yes, if you want to join the June course from August, it's fine. What will be the timing of the class? 7:30 to 9:30 p.m. Sydney time. So as I said, there is no specific offline course. The course the course that we offer, this is the course that people do it. Some candidates do it as offline, and it is exactly the same fee because we give everything. Okay, so there is no different fee for if you are only doing a recorded class. How can I make payment from Bangladesh? So if your country has some kind of problem with making payment more than a certain amount, then you can ask multiple invoice from us. So in that case, you will either send a message to me in my messenger, or you can send it to our email. So what we are going to do, so this is our email, firstaidamc4536@outlook.com. So we're going to give you 2 or 3 different invoice so that you can make the payment in that way. So in that case, please do not try to make the payment through the website. Everyone else, we do not provide invoice for others. So please make sure when you want to register for the course, just come to this website, and after you come to the website, you can go to the website, give it a read, and then click on register now. And then it will ask for your email address. The email address will get a one-time password. And once you put the password here, then you submit, then the website will take some information from you, and then you make the payment, then you get a confirmation. That's the way to do. There will be no more psychiatric discussion today, but we will do more psychiatric discussion in our course. Today's class recording will be given in our Facebook group, so in here and also in the YouTube. It is not necessary to score 50% in each subject, but the idea is that sometimes AMC, when they give the scoring, if you, it's a, I have seen in most of the examinees that if they don't get that 50% in a particular subject, then then they usually can't pass the exam. So although they don't specifically say this, but most of the time I have noticed that the people who fail the exam, if one of the subject they did not get more than 50%, they will fail the whole exam. And those are the candidates who usually fail as 249. Okay, so yes, so you should at least score more than 50% in each subject. Yes, so if you want to complete the course in 2 to 3 months, that is possible because we will upload all our the recently finished classes. All that class will be already recorded and it will be provided to the new course as well. So if someone wants to do that, finish everything in 2 to 3 months, that is also a possibility. Yes, so Dr. Amal, recording of the last class, that means the previous batch class, will be available in your portal. So we provide a lot of recorded classes already. So the, the last 3 years question solve class, that recording will also be in your portal. So there will be a huge amount of question solve class for you to go through. And every week we add more and more question solve classes as the live session goes through. There is no installment payment available for the course. Yes, question solve will be there in the course, as I've said already. The course will end, so it is a 5 months course. So the course is designed to end in the end of October or first week of November. Yes, so I always say that if your exam is next year, like early next year, then yes, you should join this course because you need some time to prepare for the exam. So please don't wait for the end, okay? Because our next course will start in November, which might help for candidates who are appearing like let's say May or June. But I always suggest that if you are going for March, April, then this course will be really important for you to go through. There is nothing forceful, Dr. Fatima. we can't force you to finish everything. It is you are no none of you are like a medical students anymore. You are doctors, so we can't force you to do anything. You have to prepare your thing. We will provide guideline. We will provide everything you need, but the thing is that you have your own responsibility as well to finish everything that we are doing in the class. So that's on you, definitely. We will give you a little bit of push time to time, like do this, do that. But if you don't do it, we can't do anything about it, right? That is definitely up to you. February, we have a lot of students who pass February exam. So that is a myth also. So please do not go with those myths. So it's not that February exam is hard. No, the class is 2 to 3 days a week. So 3 days a week class. That's right, Dr. Maria. So don't worry, Dr. Rihan. February is not like that, that they will give a new guidelines. There is no new guidelines. So very rarely there will be new guidelines which will come up. So I don't say that don't go for February exam, because you will see that even this year our students passed February exam without any problem. So it's not like that. No, Dr. Rahul, it will not affect your AMC exam. They don't bother. If as long as you have MBBS certificate, you can appear for AMC. Yes, if you have a gap of 3 to 4 years or even 10 years gap, the course will be for candidates who has basic knowledge. So we will improve your basic knowledge to advanced knowledge. So how to get into the portal? Once you make the payment, Dr. Farah, once we start giving access, you will get an email that your access to the portal has been approved. Then you will be able to just log in using your ID. We haven't given access to anyone yet. It will be given in June. Yes, the reference books will be given to everyone in the course as a soft copy. Yes, so if you want to go for November exam, it is doable for this course students. But in that case, I will suggest when we start giving the previous batch recording, you should also in between the classes try to cover those recorded classes as well. That way you will be a little bit more ahead, which is better. And Dr. Fatima, I think we answered these questions already. Epic account can be created anytime, doesn't matter. It's better to create earlier than later. Australia provide visit visa, but it is a difficult country to get into as a visitor visa. I always suggest please do not try that, okay? Because they are very picky about visitor visa. So if you don't have any relatives, then it's going to be very difficult. If you have your brother or sister here, then come as a visit visa. Don't come for the exam. And when you come for the visit visa, just go for the exam. That will be the easier way. If you want to come just for the exam, it will be difficult to get a visa, especially for MCQ. Clinical, they do. So our classes, because sometimes we add extra classes, sometimes it might not be completely fixed, Dr. Neumann, but there are fixed classes on Tuesday and Friday. So Friday and Tuesday and Saturday, these three is fixed class, but sometimes if we need to add one extra class, that will be just given as part of his schedule. So the course will cover all researches. When we discuss some topic, we discuss from everywhere. So you don't need to study them beside the course. We will discuss about CPD points in there is a class that we take for registrations and pathways. That's the class when we discuss the CPD. Just to give you an idea, the AMC, the course that we take, it also provides CPD points. So you will see that when you come to the fee structures, there are 4 fee structures. So the main thing to remember is that if you have recency of practice, that means if you are currently working in your country, you don't need to worry about CPD. Okay, then choose either the option 1 or option 2 based on how many months you want the access to the portal. If someone wants CPD certificate, then you have the option of 3 to 4. Okay, so if there is any concern about these 3 or 4 that you want to know more, just send me a message or something, then I'll answer your queries. But the idea is that if you are not currently working for a few years, then yes, this course can help you to get that CPD point. So we will give you a certificate with CPD point of 150. So that might cover you for at least 1 year. Okay. So this is only needed if someone is not working at the moment. Okay. So if you don't work, then definitely it's worth doing this CPD certificate as your plan. And in that case, what we do that even if you choose 1 or 2 options, you can still add our class as part of a CPD, but in that case, you need a membership from any other CPD provider, which will cost you more or less the same, that like even more than what we are taking from you. So every CPD providers will have some membership fee. So that's why the fee gets a little bit higher. There is nothing we can do about it because we will need to buy the membership for you anyway. So if you really need a CPD certificate, especially if you have a working gap, then choose this 3 or 4 option. Otherwise, the most affordable option is option 1, and that's what I will suggest. If someone wants a little bit more, like more access, 15 months, for them, yes, then you can try the option 2. But most of you will be fine with option 1. For QBank, so we can't provide this QBank for you because these QBanks are someone's else property, but you'll be able to get these QBanks everywhere. I think like Telegrams, WhatsApp, everywhere you have, like people put these QBanks anyway. So it's not very difficult to get the QBanks. But I want you to see this one. So there is, where was that? This one, yeah. So this is the eMedici QBank. So I was going with this. So you'll see that this is how it looks like. Now, to me, I think that it is not exactly how the handbook questions were. Although AMC is like giving a lot of emphasis on this QBank, and you can get a 1 month free in here, I guess. So if anyone wants, then yes, definitely worth reading it. But this is how the AMC exam questions doesn't look like. AMC exam questions are much more complicated than what they have given in this QBank. So again, if you want, then you can read it. It's not must to do. Okay. So it's up to you completely. No, you shouldn't use the portal in phones because phone doesn't give a very good experience, especially for mock exams. Dr. Madhu, we discussed about this, like how the exam questions get adapted during the exam initially today. Have you joined a bit late? I want to appear for March. Do this course will be provided till March if I subscribe from this June. So choose the option which will provide you the up to March. Okay. So there is options in here. So let me discuss this because then I think it will become much easier for you. So the new course is starting from 14th of June. today we took your trial class. The free session is going to start from 14th June. So you will get the schedule of this class in our Facebook group. Okay. And we will also provide it in our website. Just over here, you'll get the schedule as well. So we'll add that just in few days' time. So the course summary is that it covers everything that you need for your exam. So we cover full theory. That means all the basic knowledge that you need for the exam: cardiology, psychiatry, respiratory, so medicine, surgery, every theory will be discussed in the course. And that is mandatory for everyone who wants to pass this exam. Okay? We have the 5 years recent sample question discussion. And as I said, we take 1 to 2 class every week just on question solve, which are recent. You get software-based different mock exams, QBank recorded class with extended video recordings. Class duration 5 months, 3 to 4 days a week. Friday, Saturday, Tuesday is fixed. 1 to 2 class on recent question solve. Now remember, we take every class as a live class. We don't put a recording and say, just do it. Okay, so every class we are going to take is a live class. So you can ask questions, you can interact with us as you're doing now. We will cover complete theory based on the appropriate guideline. Then you get a theory-based question discussion, like I said. In your portal, in the student portal, we also put theory-based mock exam, like cardiology mock exam, respiratory mock exam, like that. Then we have 5-year sample question discussion. So there are recordings of previous question solve, plus the 2025 questions are discussed as a live class. Then you also get monthly mock exams. So all the monthly mock exams are also getting updated every month in the portal. Then you get, at the moment, there is 4 full 150 questions mock exam. So there are 3 to 4 grand mock tests, which means it will be exactly 150 questions. It will be like similar like your AMC MCQ exam. We also take extra classes on ECG, CT, X-ray. So a lot of other extra classes is there, like STAT, fundoscopy, ABG, which is necessary for your exam. Class recordings and notes will be there after class, and you have the access. So you can choose total access of 10 months with the subscription plan 1. With the subscription plan 2, you can even go for an access of 15 months if you want. All the necessary materials will be provided. And also, you will have if you want, you can always ask us to offer you one-to-one session on job search or job hunting. So as a course student, you will get that opportunity to know that what's your next step after passing AMC MCQ exam. But there are some small fee for those one-to-one session, but we provide this as part of the course as well. If you don't have 5 months time before your exam, as I say that all the recorded sessions of our last class will be uploaded to your portal. So there are candidates who joined our recorded sessions 1 month before their exam and they passed the exam. So we have those kind of example as well. Already you can also, there are lots of trial classes which we have taken before. These are already available in our YouTube. So you can always go to this YouTube, and if you want, you can go through some of the recorded trial classes over there. This is the fee option. So AMC MCQ 5 months course. So what it does that you get an access of 5 months during the course, and then another 5 more months after the course. Gives you a total 10 months. That's $599 plus 10% GST, and you can read the others. All of our doctors are doctors in Australia who have definitely passed their MCQ exam and all. So you can rely on our mentors to provide you the appropriate guideline which we practice in Australia. If you want to enroll to the course, the best way would be to come to the website and register from here, and then you will be sent multiple emails about the next steps. If you have any queries, you can send the queries to our email, or you can always send me a message in my messenger in the Facebook. So if you are part of it, you can always just click on Dr. Arshan Ahmed and then just send a message here. All right. So that's pretty much everything that the course has to offer. But as you say, that the course has evolved throughout the last 8 years. And if you have heard from other people, you will never get any kind of bad comment for this course from anyone. The course is designed in that way with multiple updates. With we have like taken a lot of times to make this course as smooth as possible and as better as possible. Okay, so you will have a good time with the course, that's for sure. Didn't understand the Dr. Fazilat. During free class sessions, will you have access to the recorded videos? If you are a course student, yes, we will start giving you the recorded. Remember one thing, that once you get access to our portal, your course, you will not be able to get any refund, because we offer a refund to anyone who wants to just explore this 2 week session. But in that case, if you have made the payment, you just need to inform us that yes, I want to wait for 2 free weeks classes before you give me the access to the portal. In that case, we will not give you the access. And if you want, we can refund you back. But if we give you access to the portal, because portal will have everything, you will no longer get any refund from us. Okay? No, that's not possible, Dr. Sumaya. The we don't divide, we can't take extra payment just for CPD certificate. So that's not what can be done. The course fee structure is exactly what it is written in the website. You don't need a CPD certificate before passing the exam. So CPD, as I say, Dr. Ariz, it's kind of it's a professional, we call it continuous professional development. It's only needed for Australian doctors, actually, who is working in Australia. But if someone has a working gap, then before you get registration from APRA, you if you show that you have done something during these gap years, then APRA will consider that working gap. So if you have a working gap or you are not working at the moment, then yes, having this course giving you a CPD certificate will help you to get your registration from APRA. And the working gap can be like usually 3 months working gap is nothing. Anyone having ideally more than a year gap, that is the time CPD is must. There is a schedule that we provide once the course is started. You don't need to buy any book. Soft copy is difficult, but remember one thing, that nowadays no one actually read the hard copy. I know that we like I also used to read hard copy because I didn't like the soft copy, but when you start working in Australia, there will be no hard copy. Everything will be soft copy. So it's a good idea to start changing yourself into the soft copy version. Because in Australia, you will not see any hard copy book anywhere. Okay, so everyone reads through the laptop. And when you work in Australia, also it's the same. You will be working on your computer. All the patient's notes and everything, you will write it in computer. You will look at the guidelines from the computer. So learn this. If you are trying to be an Australian doctor, you should learn how to read from a soft copy. Okay. Not really. So you can only choose a particular subscription plan, but after that, you will not be able to extend the duration of access. CPD certificate is valid forever, but if you do a class or a course in a particular year, you can only get CPD for that particular year. Okay. So let's say you did our course on 2025, you can't use this for 2028 because in 2028, you need to do some other course. So CPD certificate only works for that particular year. At a time, you can only use one device. So this is a one device portal. You can't use multiple devices because people like abuse our portal a lot. So you can only use one device for our security, and that is not negotiable. Yes, any clinic is fine, Dr. Shafak. As long as you are working, you will be fine. All right. So there are lots of questions I know for your like working and experience. We will be having another sessions. We will discuss that in detail. So today we will not actually go in that much of a detail about CPD, about the work and all. There will be a separate session for that. Please keep it for that time. So classes are usually 2 hours durations, and the timing of the class is 7:30 to 9:30 p.m. Sydney time. All our course, so all the subscription plan, Dr. Amal, will have a CPD hours. The difference is with subscription plan 1 and 2, you need, if you want to have a CPD certificate, that means the certificate will have CPD point on it, then you need, like for subscription plan 1 and 2, then the ideally what you need to do is to get a membership from other CPD provider like RSCGP, ECPRAM, like that. So subscription plan 3 and 4 will give you that specific CPD certificate point. Okay, you don't need to get any other membership from any other colleges. That's the only difference. But any plan 1 to 4, that means any of our classes that we are taking, you can add our classes to get CPD hours. Okay. It's a bit confusing, I know, but we will make it easier for you.